Welcome back to Studio 701. We all know this has been an incredibly challenging year.
And for some more than others, but today we want to focus on the health professionals facing the pandemic and much more.
Dr. Melissa Hankey, the medical director of the North Dakota Professional Health Program, and Ann Lysett, the executive director of Ndphp, are joining us now today. Thank you so much for being here, ladies.
Thank you for having us.
Now tell us a little bit about Ndphp and when and why did it become a program?
Well, the North Dakota Professional Health Program was established in 2014 through legislation so that medical providers licensed through the Board of Medicine can have an alternative to discipline, meaning that as long as there is no public or patient safety, they can come into our program anonymously for substance and alcohol abuse, and they can get the help that they need anonymously.
All right, it's to help physicians, physicians' assistants, medical students. Why might these professionals be more susceptible to physical or mental health conditions?
We're actually not more susceptible, but we have the same susceptibility as the general population. So just because we have the knowledge and the education doesn't mean that we are protected from mental illness and substance use disorders. Most of the risk factors that contribute to these illnesses actually lie in our genetics. So we're not more susceptible, just equally susceptible.
Now, how many medical professionals in North Dakota have been helped through this program?
When we look back through the numbers, and again, we were established in 2014, we took our first participants in 2015, but when we look back, we're talking about dozens of professionals that have come through our program who have gotten the help that they need and are back to having thriving practices.
Now, confidentiality, anonymity is so important in the cases of helping physicians who might have a mental or physical health condition. How can you ensure their anonymity through the program?
Well, in the state of North Dakota, being that we were created by legislation, it is written into Century Code that a physician can come into our program anonymously as long as there's no violation to the Medical Practice Act.
And we are the whole Ndphp. It's just the two of us. Yeah. So we don't talk about work outside the office. And so when a provider contacts our office, all of the work and all the communication happens with us, and we don't notify employers. We don't notify anyone unless there has been a threat to patient safety or public safety.
Now, how has COVID-19 affected the number of people using the program?
Well, I don't know that we've seen a huge spike since COVID-19, but we're still fairly early in the process. So I think that what we will see is, as we go down the road, we might have more referrals. But I know if you look at the statistic, alcohol sales are up, and I know local treatment providers are being inundated with phone calls, and overdoses are up, and suicides are up. And so I think all of that will eventually end up landing in our office, but physicians and medical providers, we tend to be fairly reluctant to seek treatment and to get the help that we need because we think that we can fix it ourselves. And so unfortunately, a lot of times with medical providers, they are further along in their illness by the time they seek help. So one of the things that Ann and I are very passionate about is making sure that people know we exist and that they know we are there to help, so that earlier on in the illness, they will contact our office and get help, because we know when we treat chronic medical problems, the earlier we can intervene, the better people are going to do. So we definitely want people to call us sooner rather than later so that we can get them back on track.
It's been great to learn more about Ndphp and all the good that you ladies are doing. It's so important to know about. Can you give us an example, without names, of course, of a success story that a physician might have had by using the program?
You know, I think that just making that phone call is a success. But one in particular, or a couple, we've had medical providers that have lost their medical license and could not practice. And through coming through our program, they've been able to regain their medical license. They have unrestricted licenses. They're thriving in their practice, and they're healthy.
You sent us a testimonial that I thought was really powerful. I'm just going to read a little bit of that testimonial. I am one of the 10 to 15% of people in healthcare that at one time abused alcohol. I was aware of the problem but didn't have a clue how to change my behavior. and lifestyle to get on a road to recovery and sobriety. The program at Ndphp, along with the people there, have helped me on that journey. How does it make you feel hearing a testimonial like that?
I think it's awesome. And the best part for me is I hear that, and I don't know which one of our docs said that, because there have been multiple that have come into our program and walked that road, and they are our best advocates. We have a new participant in our program, and we called one of our long-timers to see if she would be willing to help this new provider, and to hear her excitement in being able to give back to someone that is in the same spot she was in a couple years ago was really awesome. We have just some amazing docs, and they're willing to help, they're willing to support, they're willing to tell their stories, they're willing to make a difference.
For more information, again, how should we reach you?
You can reach us at ndphp.org, or our number is 701-751-5090.
All right, is there anything else that you would like us to know?
No, thanks for having us.
Thanks for having us.
Thank you, ladies, for all that you do.